Sean.
Marco.
We are here to deliver a message from the RSA conference team.
It's an important message from our friends. RSA Conference 2025, just around the corner, where insights drive action, solutions emerge, and community connections spark innovation. You'll be there. I'll be there. We invite everybody else to be there April 28th through May 1st. You can secure your spot at rsaconference.com/ITSPMAG25. That's ITSPMAG25. See you all there.
I'll be there. See you there.
Marco.
Sean.
We're on the road.
I know, to Las Vegas. We're going to drive, or we're going to take a plane, a train, out an automobile.
I'm just going to put on my VR glasses.
And, it's a virtual one this time, isn't it?
I don't think I'm going to get to Vegas physically for this, but we're still going to have a good chat with the HIMSS team, specifically Albe Zakes. How are you, Albe?
I'm doing well. Thank you so much for having me on today.
Good to have you on. I've been to many HIMSS. It's an impressive conference where all things healthcare come together for the benefit of ultimately the patients, right? Obviously, companies come together and researchers and everything else, education and government and policy, but all in the spirit of bringing better things to us from a healthcare perspective. Quickly, so we're covering the HIMSS 25, which is March 3 to 6 in Las Vegas at the Venetian Convention Center. I'll be a few words about your role with HIMSS and maybe brief background on the conference that's been going for a while now.
Yeah, absolutely. So I am the Director of Strategic Communications at HIMSS. HIMSS is a global society of health and technology professionals that's existed for over 60 years as a way to bring together thought leaders, innovators, executives, clinicians, and practitioners of all kinds together to talk about how we can harness the power of information and technology to do exactly what you said, benefit the patients, expand access to healthcare around the world. We always like to say that technology is the how, but the why is patience. So our goal in the end is always to make sure that we're, again, increasing access to healthcare and improving patient outcomes around the world. But the channel by which we do that is by harnessing the power of information and technology, whether that's interoperability, artificial intelligence, cybersecurity, workforce development, all these other key trends and topics that everybody in health and technology is talking about. HIMSS becomes the platform for innovators, for researchers, for practitioners to come together and share their insights. And it takes place year round. We have a variety of events other than our global conference, but the global conference is certainly our marquee global event. We'll welcome somewhere around 30,000 people to Vegas, as you said, from March 3rd to 6th, featuring everything from keynote speakers to the folks that are doing the actual technology work at health systems and hospitals around the world.
Cool. So before you give us some teasers from who the keynotes are going to be, some highlights, I'm the kind of guy that always like to look a little bit into the past and then, eventually a little bit into the future. So it's been going on for 20 years. And of course, technology, as we know, it goes faster. Every normal year is many years for technology, maybe even a century. I'm going to exaggerate here, but how has it been changing the event from the beginning or even, in the past 5 years or so? I mean, technology has been moving so fast.
Well, I think that's right. I think the focus of the event itself changes as the technology that folks are utilizing, that folks are thinking about, both the technology of today and the technology of tomorrow. So something like artificial intelligence, I think, is a great example. 5 years ago, even 3 years ago, people were talking about it as a what if, preparing for what AI might mean. And today, AI is going to be one of the top topics. I mean, dozens and dozens of educational sessions. You'll see it talked about in the executive summit. You'll see it talked about in keynote sessions, as well as across all of our educational sessions. Artificial intelligence is here. It's a paradigm shift for the whole world, really, but especially in healthcare. And it will certainly be one of the most discussed topics at HIMSS. I think one of the big changes that I've seen in the few years that I've been working at HIMSS is it more and more it's about collaboration. Not just about folks coming to hear expert speakers and learn from those speakers, but folks working together. And in fact, this year we've expanded the networking events. We've created more breaks during the day in between education sessions to provide more opportunities for folks to network, to collaborate, and to create relationships and partnerships that will help create tomorrow's health. So I think you've seen a really big shift away from just top-down experts sharing their insights and learnings. There's still a lot of that, as you might imagine, but more and more we're trying to create opportunities and create a platform for folks to collaborate, to share ideas, and hopefully build partnerships that will move on into the future well beyond conference itself.
Yeah, and I'm gonna stick with the collaborate theme for a moment here. As Marco and I, we cover a lot of events looking at technology. Obviously, we have a deep focus on cybersecurity and also society, the impact all this stuff has on us. And the thing we often come to is that there's great power when multiple things come together. So a set of information on its own might be super valuable, a robot on its own, a back-end system on its own. But when you start to pull all those things together, it really becomes powerful, from devices within us, things that help us think better, healthcare tools, robotics, operations, the medical record systems, right? When all this stuff comes together and works properly together, we can see X-fold improvements in outcomes. Can you speak to some of the technologies and other things that really help pull a cohesive community together in a way that perhaps is more powerful than we've seen in the past?
Well, I think there's a few different things that we're doing at conference really to help pull people together. And I absolutely agree with what you said there. Our president and CEO, Hal Wolf, talks often about the symbiotic triangle of people, technology, and process, and that technology alone is not enough. And I think that's really what you're speaking to there. You have to make sure that you enable and empower the people who actually use the technology. I think you have to have continuous feedback loops from the folks in health systems, in hospitals, in health organizations that are actually using these things, that are using robotics, that are using the AI and machine learning to make sure that the technologies that are being developed speak specifically to the challenges, to the issues that they're trying to address. A great example, you talked about the data there. Artificial intelligence will only ever be as powerful as the data that we provide to it. So you need to have very clean data sets. You need to have really strong data governance in place. And only then can AI reach its full potential to help drive change and benefit in the healthcare industry and in the global health ecosystem. So I think that's really important. What we're focusing on is trying to create lots of different opportunities across conference for folks to interact with technologies that they've never seen before. So obviously a big part of HIMSS is our exhibition. Our exhibit floor is massive this year. We have over 1,000 different companies exhibiting. It's hard to even consume that much information in a 3 or 4 day conference. And so many of our exhibitors are return exhibitors year after year. So this year we're really excited to have a first time exhibitors pavilion. So these will be exhibitors that have never been at HIMSS before. They're startup companies. They're new emerging technologies. So we really wanted to highlight those first-time exhibitors. That way, attendees who have been to 1, 5, 10 HIMSS conferences will be able to take time specifically to go see what's new. Where are the emerging technologies? What are the exciting startups there? So we really think that's an incredible opportunity to connect people, not just with the technology that they're expecting to go learn about at HIMSS, but also with things perhaps that they weren't expecting. Another place where we're trying to drive innovation and introduce health and technology professionals to new technologies, new companies, and new brands is our Emerge Innovation Experience. This will be an area just off the exhibit floor that will feature the future of healthcare IT. It's going to include a pitch contest for startup companies, as well as one-on-one meetings, a whole series of meetings for startup companies and entrepreneurs to meet with investors and VCs. as well as a networking reception. So here again is an opportunity to really shine a light on not just the big players. We all know the names: Oracle, Epic, AWS. The list goes on, but also the smaller companies, the startup companies, and to see what new technologies they're bringing to the industry as well.
What about industries, meaning healthcare now has become, mental health, it's, robotic companion, aging, and so much more, like wearable. So that's another, I feel like another one of those things that make change not only the approach to people and company to the business and to society, but also the way that probably a conference need to touch on all of this. Like you come in there, and in a way you kind of see the future. So how wide is the view here when people come to the event?
Well, I think I think it's important to provide both a very high, at risk of using a cliche, the 30,000-foot view. And I think that's what you'll see in our keynote sessions, at our executive summits, at our views from the top. One view from the top that I'm particularly excited about, I was just working on it, so it's top of mind as well, but I know it's going to be a very, very well-attended and popular event, is our president and CEO, Hal Wolf, will be working with Seema Verma from Oracle, talking about the systems that they're building and services that they provide to the health industry. So I think things like that will provide that view from the top, aptly named. But then I think it will also drill down into very specific technologies. You'll see that at things like our Smart Health Transformation pre-conference forum. Here's where you'll see a lot of companies, speakers, and innovators are talking about AI-powered wearables, as well as smart technology for hospitals. And then we've also got our interoperability and healthcare information exchange forum and pavilion. Again, that's going to get down into more specific solutions that are driving the future of healthcare information and exchange, that are driving patient communications and connectivity, and are highlighting things like wearables or other different smart technologies that hospitals are deploying, again, not only to help patients and improve care delivery and access to care, but also to help operationally create efficiencies, fight workforce burnout, clinician burnout, and help to develop the healthcare workforce of the future.
And I'd be remiss to point out that it's actually very exciting to see it. There is a cybersecurity experience. That's one of the sections. Not every conference dedicates time to cybersecurity in the rest of the world that they're looking at. So it's great to see that. Can you give us a quick word on what that looks like?
Absolutely. So, cybersecurity might not be the most exciting technology or topic that we're talking about.
It is for Sean, so be careful what you say.
That's right.
But it's certainly potentially the most important. The cybersecurity track at HIMSS 25 is going to include a lot of really exciting things. We'll have our pre-conference forum. The Healthcare Cybersecurity Forum takes place on Monday. That's before the main conference kicks off. We'll also have a competing AI and healthcare forum. So for those pre-conference forums, folks will have to split their time or pick one or the other, whether they want to focus on AI or healthcare cybersecurity. I'm very excited for both of those forums. But we'll also have the Cybersecurity Command Center, which will be set up on the exhibit floor. And that's going to provide insights and solutions that will help enhance cybersecurity measures, help to protect patient privacy, secure healthcare data, and of course, stay ahead of the ever-evolving cyber threats. And I think, I really want to double click on the protecting patient privacy. As healthcare providers and organizations look to build and maintain trust with patients, cybersecurity is vital to that. When we look at things like HIPAA and protecting patient data and healthcare data, cybersecurity is vital to that. And so I think that's a very important topic. I expect the Cybersecurity Command Center to be one of the more exciting, energetic, buzzy, if you will, parts of the exhibit floor. But we're also going to see cybersecurity talked about on the keynote stage as well. We've got General Paul Nakasone, who is the former U.S. Cyber Command and Director of the NSA. He'll be providing a keynote, I believe, on Tuesday morning that will examine the challenges and opportunities of cybersecurity, as well as staying secure in a world driven by AI. So very interesting to hear from a former director of the NSA. And then we'll have a variety of educational panels and talks about cybersecurity. Folks from the Cleveland Clinic, from UVA Health, and other hospitals providing real world examples and the insights that they're learning and will be sharing from their actual work doing cybersecurity efforts at major health systems and hospitals. So I think both that high level view that we'll get from General Nakasone, but also the more specific, again, drilling down to specific topics from the actual practitioners, the actual cybersecurity managers and directors at major hospital systems across the country.
Yeah, and talking about being a wide view on society, I know that one of your major keynotes, and I would love to hear others that you are very excited about. It's an athlete that we all heard about, Simone Biles. That's exciting, and I think it's always important when people look at people that achieve so much on a from a physical perspective, mental perspective, to hear their view on this, because again, healthcare it's really about life to me. So. A couple of words about the keynotes.
Yeah, so obviously we're excited to have the GOAT, Simone Biles, join us, and I do think it's a really important message for exactly the reasons you just shared. We mentioned earlier that symbiotic triangle of people, process, and technology, and I think Simone's story of perseverance, of overcoming, will be incredibly inspirational to people. But also how to interact with people, how to engage with people. So I think when you look at leaders from healthcare organizations, they're looking for stories and strategies to inspire their people. And I think Simone's going to provide exactly that. I think it'll also be really important. I think perseverance in the healthcare world is incredibly important. We're all facing funding challenges. We talked about workforce burnout briefly. So I think the message of persevering and overcoming is going to be very important and resonate well with the audience. We've got a variety of other views from the top speakers that'll take place on the keynote stage that we're very excited about. I mentioned Seema Verma, EVP and General Manager of Oracle Life and Health Sciences. But we're also going to have folks from Blue Cross and Blue Shield, Humana, the New Jersey Department of Health are all going to be interviewed for our views from the top, talking about addressing public health crises, talking about transforming healthcare in a payer-driven world. We're going to have a top thought leader on AI, Tom Lowry, who is a best-selling author and an AI transformation advisor. He's going to be doing a views from the top session for our keynotes about creating value at scale through large language models and AI models. So there's just going to be so much touching on every different aspect of the challenges facing the healthcare industry. Again, from those keynote sessions right down to nearly 300 education sessions that will dive in deep on specific topics.
Well, I'm almost thinking I should change my plan and drive there. I'm in LA, so I could do that.
It's a great conference.
Exciting.
You'll walk your legs off looking at all the stuff. What's exciting to me, I mean, you can see all the flashing lights and everything's shiny and new in a lot of tech arenas, but none, in my opinion, have more impact on life and society than obviously keeping us healthy. So just the work pulling all this together and having these conversations and bringing folks together to collaborate is super important. It's March 3rd through 6th, the Venetian Convention and Expo Center in Las Vegas. I'm sad I'm on the East Coast. Maybe Mark will make a drive. I'm hoping to have more conversations with some of the folks at the conference, even if it's remote and virtual. A lot to discuss, a lot to take in, and Albe, great to have you on. Any final thoughts as we wrap here?
Well, I think, Sean, you mentioned that there's nowhere that technology impacts people more perhaps than healthcare. And so I'll make a final plug for another forum that I'm very excited for, which is our Health Equity Forum. Health equity drives the vision and the mission of HIMSS. Again, that relates back to technology is the how, but people are the why. So excited, again, another pre-conference forum on Monday that will have leaders from state, local, and global governments, as well as nonprofit organizations from across the world getting together to talk about the most important topic, perhaps, other than AI or cybersecurity, and that's health equity and how we expand healthcare access around the globe. So very excited for that one as well. Sean, sorry that you won't be able to make it. Marco, if you need press credentials, please feel free to reach out and I'll make sure to take care of that for you.
I appreciate that. And definitely, I can see a lot of other conversation in the future coming with you guys. Of course, I talk about technology and society. And as you mentioned, there's not much more important than health to touch on the future of society and the consumers and humanity in general. So thank you very much for your time. Everybody stay tuned. This is On Location with Sean Martin and Marco Ciappelli, which is me. Either we are on location or virtually. We try to bring you the best stories. So stay tuned with us, subscribe, and many more to come to you. Thank you, Albe.
Thanks, Marco. Thanks, Sean.
Sean.
Marco.
We are here to deliver a message from the RSA conference team.
It's an important message from our friends. RSA Conference 2025, just around the corner, where insights drive action, solutions emerge, and community connections spark innovation. You'll be there. I'll be there. We invite everybody else to be there April 28th through May 1st. You can secure your spot at rsaconference.com/ITSPMAG25. That's ITSPMAG25. See you all there.
I'll be there. See you there.